You want to know how to solve very challenging questions, stimulating your mind, critical thinking questions. Stick around and check out how it's done. Test taking strategy for NCLEX practice questions. First question, straightforward, but a lot of content being asked, right? How do you answer question in the NCLEX? Start from the back. I know it's a select or apply. My mind is telling me this is what I'm looking for. Which of the following actions I'm looking, these are all buzzwords. I'm looking for my buzzwords as I move from my ask, case, buzzwords, rewrite, and then choose an answer, right? So select or apply, looking for action. And this is caring for a client with hemoglobin of 6.5 is unnecessary. We need blood transfusion. What actions are appropriate? I tell myself I have a SATA question. I'm looking actions that are appropriate. That's all. And for SATA, I need to bring my content. I'm going to look for answers that I think I know 99, 100% sure, and I'm not guessing for the new generation, new questions, new NCLEX way, right? What is the key? Is blood transfusion. So you need to know everything about blood transfusion. What is the answer? RN takes the vitals 12 minutes after initiating transfusion. The first 15 minutes of transfusion, RN will take the vitals. So this is right. Normal saline as a primer. We use only normal saline, and it's just used to prime the tube. That is this function. We use a Y connector for blood transfusion. That's all. So the blood goes like that, and you have normal saline that goes here as a primer, and then the blood goes here. It only goes in when there's no blood transfusion. That's the normal saline. As soon as you start the transfusion, you block this. You stop it. LPN help to monitor the transfusion rate. The word is what? Monitor. The function of the LPN does not initiate the transfusion, but they monitor the transfusion rate. Good. UAP pick the blood from the blood bank. This does not involve any thinking. I just go to the blood bank, tell them about the patient need the blood, and they give it to me. So UAP can do that. UAP take vitals 30 minutes after blood transfusion. Yes. After the first 50 minutes, the nurse can delegate to the UAP. Client with 18 gauge IV, or IV needle, basically. You can get 18 to 20 gauge is good. Next, set transfusion limit to 4 hours. Yeah, you should not transfuse blood past 4 hours. So that's the limit. So all of this is appropriate. This is just for teaching purposes. In your exams, they will give you wrong answers, but sometimes I set questions to give you content so that when you see the wrong answer, you know, I'm giving you the right answer. So most of the things they will ask you is what I've given you. If they change it, they make it another way, then it's a wrong answer. Okay, first question down. Critical thinking, right? Number 2, right? Read from the back. The nurse will document what diagnosis, so diagnosis. 35-year-old with depression on sertraline was admitted due to recurrent depression. During the admission, the client was abusive and hit the nurse in the face. We have a problem, abusive patient. Patient was chemically restrained with fluphenazine. You have to recognize this medication, fluphenazine. 4 hours later, patient temperature is what? 104, the muscle rigidity. What is your diagnosis? Critical thinking. This can be a full case, right? I'm looking for diagnosis. I have a depressive patient, right? Taking sertraline. This is a distractor, right? Is it unnecessary? The main problem, patient became violent. You see how I'm summarizing the case? And then we give the patient fluphenazine. You have to recognize it. All of a sudden, temperature is 104 and muscle rigidity. There's taking strategy. I'm taking 10 seconds to write this. What do I tell myself? Depression, and I give the patient this medication. This is antipsychotic. It's a first generation antipsychotic. All of a sudden, temperature is high, muscle rigidity. What do you think? One of the common side effects of the antipsychotic is NMS, EPS, right? Anticholinergic, antihistamine. So, what do you think is going on? It's not serotonin syndrome. This is a distractor because of this SSRI. No. Extrapyrodermal side effect, the patient will be showing adapt symptoms: acute dystonia, akathisia, Parkinsonism, and tachydyskinesia. That's not what the patient is showing. Malignant hyperthermia, patient will have family history of malignant hyperthermia, or they will tell you patient just had surgery. Surgery is the key. There's no surgery yet. So we left with it. Neuroleptic malignant syndrome. That's what the patient is showing, signs of neuroleptic malignant syndrome. This is a classic example of a case. You can get full case or bow tie case in new generation. So number 4, right answer. Right. Answer 4. Number 3, selected apply. Okay, this is a bunch of selected apply to give you content. Which teaching is appropriate? A nurse is caring for a client on Bumetanide for heart failure. In the pharmacology in NCLEX, they will give you the medication and they tell you what it is, or they will tell you what the problem is and give me a medication to treat it. So that is what you have to learn. So my SATA appropriate, I take Bumetanide and a heart failure. Tell myself, what is this? This is a loop diuretic. What do? They will decrease my potassium. They will also decrease my sodium. That's how they control your blood pressure and edema, right? They can make you dizzy, right? But which of these is appropriate? Avoiding green leafy vegetables. This will give you potassium. I don't think it's appropriate. Avoiding orange juice. This is also help with the potassium because the potassium will be low, hypokalemia. Avoid banana. This also help with your potassium. Avoid salt substitutes. Salt substitutes have high potassium. So that's wrong. Avoid ready meal. Yes, ready meal has a bunch of sodium in it, like fast food. It's like fast food. Therefore, if you're taking Bumetanide for heart failure patient, they need to decrease their sodium. And Bumetanide is trying to lower your sodium. You can bring me more sodium in. So it will take a long time for me to work. So this is appropriate. Only one answer. Selected apply. Pick those you know is confident. Only one answer there. If you pick more than one, you get 0. It's new generation. NCLEX, SATA. A client was admitted to the oncology clinic for brachytherapy. Which of the following should be included in the plan of care? Select or apply. The same thing, pick those that you're confident, right? But you got to break it down. Don't answer the question until you figure out your buzzwords. SATA, brachytherapy, which I should include with the plan of care. Those are my buzzwords. Okay, those, and I connect my buzzwords to make a sentence. What plan of care I should include for brachytherapy? Brachytherapy is somebody who's having radiation, but this is implanted in them, put it inside them, and let the radiation do its job. It's internal radiation. It's different from external radiation. Then after that, they take it out later on. Okay, so you got to provide some radiation precaution. Number 1, dosimeter. This measure how much radiation is around the patient. The patients already have radiation in them. Why do they care how much radiation they're going to receive? So dosimeter is usually given to the nurse, not the client. So the nurse will wear this to see how much radiation she's being exposed to. If it's too high, we got to change another nurse. Okay, so not the patient. Patient already had radiation in them, so this should not be included. Appropriate Shielding for the nurse. Yeah, a wet-led shield. Bedside commode, so that the patient doesn't get out and then the radiation fall off, especially if it's a cervical, it's through the vagina, it may fall off. So this is good. Lead handling at bedside. Yeah, if we fell, the lead falls off, you have something you can handle the lead, or so they have some instruments at bedside to be able to handle. You want to cluster your care. You don't want to go to this radiation field every time. So you do all your things together and come back. Do your things together and come back. Cluster, okay. So these 4 answers are right. So that's that question. Select or apply. Like I told you, this is all select or apply, content-based select or apply. Which of the following the nurse should anticipate? A nurse is caring for a client with Cushing disease. What do you think? Endocrine, easy, right? You have Cushing, and you have to break it down, okay? That's my buzzword. We should anticipate. That's all, 2 words. Cushing, and that's what I can see. Then you tell yourself, what is Cushing? Cushing is have too much steroid, right? What does steroid do? You hold on to water, so your sodium is high. You get rid of your potassium. Potassium is low, right? It make you, because it's hold on to water, you have hypertension. This is related to that. Okay, you can have edema and you can gain weight. And the weight also comes because it does not allow you to break fat. So fat deposit. So you gain weight. Fat is deposited centrally, right? You have too much hormones in the system and you can have hirsutism. It affects your collagen and you have abdominal striae. All these things, right? It's a stress hormone. Every stress hormone will increase your glucose. You see what I'm doing? Therefore, hyperkalemia is wrong. Hypertension is right. If your glucose is going to go high, you'll be hyperglycemia. Bronze pigmentation, that means your skin is brown. You need melanin. This is very common in Addison. You don't see it in Crohn's, in Cushing. Be careful. Bronze pigmentation only seen in Addison disease because of ACTH, which is very, very high in Addison, ACTH. In Cushing, ACTH is low. ACTH is low. Therefore, you're not going to see this. If you're going to gain weight, your BMI shouldn't be 18. So there's only one answer. I intentionally set it that way. This is too low. You don't see this. This should be hyper. This will be hypo. So only one, hypertension. Okay. Select or apply. Same thing. A nurse is caring for a client diagnosed with what? Scarlet fever, right? The nurse is aware that the disease can cause what? So SATA, scarlet fever, buzzword, right? What would it cause? Okay, that's all. What would it cause? Those are my buzzwords. I'm breaking down the question. Scarlet fever, focusing on scarlet fever, what does it cause? So this is caused by strep, right? Strep A. This is why we treat it. And they have what we call sandpaper rash. That's the buzzword in the sentence. Sandpaper rash. What does it do? Post strep, it affects your kidney, it affects your heart, and it affects your joint. So they have post-strep glomerulonephritis. They can have rheumatic fever, heart disease, and arthritis. It does not cause pyelo. It causes glomerulonephritis. It does not cause thrombocytopenia. It causes arthritis. It does not cause meningitis. It causes heart failure from valvular disease. So these are your answers for scarlet fever complication. Number 7, select or apply. Which of the following teaching is appropriate? What teaching is appropriate? A client presented to the clinic with back pain. Client was prescribed gabapentin, right? So the key word is what? Gabapentin, right? Have back pain. Which teaching is okay? Focus on the medication. This is an anti-seizure medication, right? Neurontin. Right? It's very good for neuropathic pain. So that's why you use it for back pain. It has certain side effects. You got to touch the patient. It's anti-seizure medication. It can be used for seizure. The most common one is neuropathic pain. People prescribe it all the time, but it's specific side effects. You have to take the patient. They should avoid caffeine. It make you very drowsy. So usually you should avoid it in older patients. Because of the drowsiness, you should not take it in the morning. Okay? Leg edema, yeah, it make you hold on to water and weight gain. This is one of the complaints they talk about. Drowsiness, yes. Because of drowsiness, you should take it at night. So these are the teaching you provide the patient. Gabapentin, right. Which of the following is expected? Okay, that means I'm looking for something I'm supposed to see there. And this is caring for a client who was diagnosed with what? Mild Alzheimer's disease. You have to know the stages: mild, moderate, and severe. Of course, they're going to have all the A's, the 5 A's. I just did a video recently. It's a YouTube Shorts review video. You should look at it. All the 5 A's of Alzheimer's disease. They all have all of them, right? But specifically for mild to moderate, yeah, you have to be able to distinguish between them. When they have dysphagia, okay, that is, and they cannot take care of themselves, inability to feed oneself, in feeding, they can't feed themselves at all, and they have dysphagia. This is a severe form. If they have anorexia, yeah, this is a mild form. They don't want to eat. And they forget that they had meal. They will eat anyway, but they forget that they have meal. They are already eat. It's mild disease. Forget to eat at all. Now they don't even know when they don't want they don't remember what time they're supposed to eat. They say, oh, they don't even know there's something called eating. That's moderate disease. So forget to eat is moderate, but they forget that they already had some food. Yeah, that's mild, and anorexia is mild. So those two are mild disease symptoms. Okay, which of the following is a priority, right? A client underwent successful kidney transplant and discharged home 4 days later. Client was seen in clinic 2 weeks as a follow-up. Which of these is a priority? Priority means something that is bad. All these things may look bad, but you want the baddest of all baddest, right? Systolic blood pressure 120. This is normal, right? So this is good. Urine output 30. It's making barely 30 ml an hour, so I'm okay with it. Temperature is 39. Fever in somebody who has transplant. Remember, I did not give you information here, but if I hear transplant, I know the patient is immunocompromised. He's taking some medication. Temperature immunocompromised patient is bad. UA, no nitrate. No nitrate means there's no infection. Therefore, this is wrong. So this is wrong. But if you don't know the answer, you can see that transplant patient and temperature, they are no friends. So that is a priority. Which of the following is appropriate? Select or apply. Like I told you, I'm loading you with select or apply. A client was admitted to the med-surg unit due to intimate partner violence. So intimate partner violence. The nurse was educating the client about the diagnosis. Which of the following is appropriate? What do you think? Content, buzzwords, SATA, intimate partner violence, and which is what? appropriate. You see, I'm breaking it down. I'm looking for a selected apply, something about intimate partner violence, and it's appropriate. I know selector apply these days is plus manual. So if I know I'm not sure, I'm not picking it. If there's only one choice I pick that I'm 100% sure, yeah, I'm picking it. Intimate partner violence is worse during what pregnancy? Yes. Only occur in heterogeneous marriage. No, you occur mono. So monogeneous, that means I forget the another word like a man and man in a marriage or woman and a woman together. Heterogeneous is a man and a woman, so male and female. This is not true. It can occur in men to men, female to female, and then men and a female together. So different, but this is wrong. The word only give it away. Eye incidents in African American. This is misconception. Just because they are African American doesn't mean so. It's not race based or ethnicity based. That's wrong. Your safety is priority. Yes, that's all I care about. Eye incident in poor socioeconomic status. The money you have is not related to intimate partner violence. Therefore, we only have 1 in 4. It does not involve your socioeconomic status or your race. Okay, GBS. Select or apply, right? Which of the following is true about a disease, right? A client was admitted to the ICU due to ascending paralysis and diagnosed with Guillain-Barré syndrome. You have to know this for your boy. Really, really well. You have to know this. What is the problem? They get the URI symptoms or they start having GI symptoms, diarrhea, and the bacteria react with your immune system and you make antibodies and you start attacking all your nerves from your leg to your waist to your chest, then finally to your airway muscles. Yeah, that's what, but it can do a full recovery, right? So what is the problem? Post-UR and GI infection, yes. Vaccination to family members, no. You don't need to vaccinate any family member. It's wrong. That's wrong. It's not something that you get it from somebody. It's just you have the infection and your body is reacting with that. It's not vaccination doesn't prevent it. You will have a bladder and bowel issue because of the nerve function. Airway is a priority. Yeah, that's what you take care of. Abnormal immune response. Yeah, that's what you're causing the problem. You're responding to the immune system is responding abnormally. So that's the problem. No vaccination. And you can really get infected after you, and you can make a full recovery. It can last for 6 months, then you recover. You can get reinfection again. Number 12. Same thing, SATA, right? The next, understand that the patient has which of the following. Okay, what does the patient have? What is the situation? A client with bipolar was placed under involuntary admission. The next understanding what? So involuntary admission means you being admitted to the hospital because we worry about you. There's certain criteria you can't meet. What are those criteria? If you are in danger or to yourself, you are not able to care for yourself, or you are a danger to somebody, right? We can do that. That's right for less restrictive environment. Just because we are admitting you involuntarily doesn't mean we have to restrict you to do anything. Yeah, this is right. So you have your right for less. Everybody when get admitted has a right for less restrictive environment. That means we don't put them in seclusion or we don't restrain them right away, right? So this patient, involuntary admission, it's just the admission aspect of it. You just admit them to the hospital. Everything you want to do, the patient right is still persistent. Just because you involuntary admit them, the patient lose all the rights they have. That's wrong. So this is right. Need seclusion, you don't need it. Substance abuse is not a problem. You can be substance abuse, and you can refuse admission, and you doesn't need involuntary admission. The three things is danger to yourself, you can't care for yourself, and you are a danger to somebody else. And if you get admitted, you need a less restrictive environment as anybody else. Okay. Which medication is the most important for manager to manage the client symptoms, basically, to manage client symptoms? A client presents to the neuro clinic with headache 1, photophobia, and nausea 2 to 3 times a month. Exams was normal. I came in, have headache, photophobia, and nausea every time. Oh, this happened 2 to 3 times a month. I'm dying. I need some help. What medication will kill me? You got to make a diagnosis. What do you think? This is not meningitis, right? This is migraine. What medication you can help control this problem? Tylenol cannot control migraine. Gabapentin is for neuropathic pain. You can't control it. Morphine, no. The best medication is triptans. Look for the last name, triptans. Sumatriptans. It's a vasoconstrictor, and that can help control migraine. You should contract. You shouldn't give it to a patient who has hypertension or coronary disease. Those are the things. But anything that has triptan, yeah, you can use it for migraine. That's their last name. Two more, then we're done. Which statement is appropriate? A nurse is caring for a 35-year-old female with 35-year-old with depression. Client was taking sertraline for 3 months and feels the medication is not working and want another antidepressant right now. Which statement is appropriate? So I'm 35. I'm taking SSRI for 3 months. So it's been long, right? And nothing is working. I need another medication right now. What would you tell them? I will ask the provider to prescribe the medication now. Wrong idea. Usually, if you take antidepressant, you can take like 4 to 6 weeks, for you to see effect. It's been more than 4 to 6 weeks, so patient need a new medication. But there's something wrong. Giving it now is a problem, so that's why this is a wrong answer. You can start the new medication tomorrow. No, you can't start it tomorrow. Continue taking the old medication. It's not doing well with it. If you want to stop, you need 14 days, what we call washed out period. And this will wash the old medication, and then you can start another type of medication in order to prevent complication, especially serotonin syndrome, since the patient is taking SSRI. So you have to wait 14 days to start a new medication. So this is good. Number 15, last question. Select and apply. A client sustained high voltage electric burn. So he has electric burn. The caring nurse should anticipate which workup. So this is the person. And thunder strike, whatever it is, burn the patient. Okay? Or electricity burn the patient. You went through the patient. What do you think you need a workup? Every muscle has to be worried about. That's muscle death is number one. And then muscle die, your kidney also get into trouble. And remember, your heart is a muscle. This is how you do test taking strategy. I'm looking for muscle problem and the kidney get into trouble. Therefore, muscle, hey, my heart, EKG, right? Why do I want to check UA? You look for rhabdo, myoglobin. You can find it. You can do a urine dipstick, and you can see. You see myoglobin or muscle tissue in it. Yeah, you're in trouble. Cardiac enzyme. Yeah, your heart. Creatinine kinase, that CK, that protein in the muscle, and red blood cell. Yes, you want to see anemia or any injury, internal. This will indicate internal injury being hit on the floor by the electricity. So this is also indicated. These are all the things you need to know. This is the end of it. I hope you learned something. Very good questions that they can ask you. Just testing your knowledge. This is how the board questions can be like. You go so many places, but you just stay focused, answer the question. If you don't know it, pick those that you're confident, and you'll be golden. If you've not subscribed, just check the link down and then subscribe and put your notification on. And then whenever I make a video, you can get access to that. Take care of yourself and keep charging as always. All the best of luck. Bye.